There's been a concern for a while with the availability of child mental health services in Kent and Sussex County. It's an area where there's been an identified shortage. So there was a more general concern, and then obviously the situation with Dr. Bradley and the number of child victims that have come forward since then that made the problem that much more acute. For the children that we know of now who are victims of Dr. Bradley, our sense is that they are getting prompt and appropriate treatment. Part of the concern is that in situations like this, you don't always have all the victims come forward immediately, and there's the very real possibility as 1 to 5 years goes by that more victims will become known, and there's a concern about the system having the capacity to continue providing the kind of prompt help to kids in the future that it's providing now. So I think the state's done a very good job in the short term of providing sort of an emergency response to the children that we know about now, but we want to make sure we can sustain that in the future. There weren't a lot of surprises in terms of the findings. We were surprised and pleased to find that there were some pretty apparent solutions to the problem in terms of some money that we had available to do some pretty straightforward things that we think that can help in terms of providing the practitioners, providing some training that's necessary, some additional case management for some of the kids that we have who need help currently. So sometimes you have these task forces and you got a whole big long list of things that you can't accomplish. We came up with a pretty manageable list of things that we think are doable. Some of them are relatively low-cost items, some additional trauma-related training for some of the frontline folks who interact with kids in school and medical environments, some funding for case management for kids who are recognized as needing mental health services to make sure they get to where they need to go and they get the services that they require, making sure that insurance coverage is available so that people who have health insurance can get timely access to mental health providers. They're pretty discreet and for the most part pretty low cost.